Okay, Assalamualaikum warahmatullahi wabarakatuh. And hello everyone. My name is Dr. Farah Roslan. This will be a retrospective recording of a presentation that was supposed to be included in the Essentials of Foundation Year and Internship webinar that was held in August 2020. But unfortunately, due to technical issues, it wasn't uploaded automatically as how we intended it to be. Hence, why I'm doing it right now. So I'm going to share the screen of my presentation. Right. I have been assigned to present on the topic of Eportfolio and career development for the UK foundation training. I was a foundation year two doctor at the time of the webinar, but and was supposed to go into core surgical training, but I'm now in core surgical training. I'm a CT1 core trainee in general surgery at the time of this current recording. Right. So it's quite a big topic. I was allocated 20 minutes, but for this recording, I believe it's a little bit more flexible now that we're not tied to a time frame. So I'll still keep it within 20 minutes to half an hour to share you all the important things that you need to know, but at the same time try to not overwhelm you, as most of you are either about to enter or already in the first couple of months of foundation year training, and I also recognize that some of the audience are medical students, so try to strike the balance between the two within the time frame. As according to the title, the outline is those two, mainly Eportfolio, something that everyone needs to do. And I'll be emphasizing more on career development, as I believe this is what sets you apart, and probably would be useful for you in your later years going into specialty training, and some other bits and bobs that I feel is relevant. So let's just dash through Eportfolio, which is essentially Horus in the UK. I'm not entirely sure if it's slightly different in Northern Ireland, Scotland, or Wales, but definitely in England we use Horus. It's quite straightforward, very self-explanatory, I feel. But it's very important. Your supervisors will not sign you off if you don't do them right. So do it right. And actually, these individual forms can be used as an evidence for your specialty application later. So it's quite important that you know how to fill them in properly, and maybe perhaps tailor them to what you think might be useful for your specialty application later on. I'm just going to dash through some of the terms and abbreviations that you'll come across when you're browsing through your Horus. Educational supervisor, as short as ES, is going to be your supervisor for the entire year, and your clinical supervisor will be your supervisor for just a rotation, so usually for just 4 months. For the first rotation, sometimes you can have your educational supervisor and your clinical supervisor being the same person, but this might not be the case for the rest of the rotation. Case-based discussion is just a long case. And mini CACs or clinical exercise evaluation is just like a simpler CBD, basically, just a shorter case. DOPS is a direct observational procedure skills. So any kind of procedural skills that you have been observed, or sometimes they don't have to observe you directly if they they think that you're confident and you're competent to do it. They could just let you talk through it, and then they sign you off later on. DCT is developing the clinical teacher, is a teaching evidence, and it's mandatory as well. So you need to show that you've done some kind of teaching, be it at the bedside or delivering a formal lecture. You need to have at least one included per year in your HORIS. And then TAB is a 360-degree feedback tool from a multidisciplinary team. So you need to get some feedback from from your colleagues and also allied healthcare with regards to how you did that. It has nothing to do at all with regards to your clinical competence. It's literally just what it is. It's a behavioral assessment. So this is what your HORIS platform would look like. As you can see, it also states the minimum number of forms that you have to do for each of the placement, what you have to do at the start, throughout the placement, and at the end of the placement as well. So I think it's laid out quite well and quite clear. And these are some of your other mandatory forms. You can also see what's the minimum at the right-hand column. It might differ from deanery to deanery, so this is something that you should just double check as well. And some general pointers is to never put any patient identifier details like their actual name, your NHS number, hospital number, date of birth. You can always just write, whenever you write a case about a patient, you can just state that age or gender, for example, a 76-year-old lady from a care home, etc., rather than giving specific details that could lead to the reader to identify who this patient that you're talking about. So try to get your form signed off early. You don't want to leave it all till the end. You can ask what your trainer expects from you. Sometimes they'll just, you just send the form and then, they'll sign it off. But some of them would want you to maybe come to their office, have a formal discussion, actually see the patient with you and see how you assess the patient. So it really depends on from a trainer to a trainer. So just find out what they expect from you. And if they don't sign your forms, just feel free to email them. Most of them really don't mind, especially, if their inbox just gets flooded with lots of email. So you can send a reminder. You can just face-to-face by email at reasonable intervals, obviously, maybe a week apart or something like that. I just want to spend a little bit more time on reflection, which is also a mandatory form in your ePortfolio. The way doctors reflect has changed because of the Bawa Garba case. If you have heard but not very familiar with, or you've never heard about this case at all, I would recommend you reading into it. It's about a pediatric registrar who has been charged with a manslaughter of a Jack Aldock, a Down syndrome boy who passed away due to a systems failure. And unfortunately, Dr. Balgapa was then named as I think the scapegoat. It was quite a long case, but I think the point I want to make with regards to reflection and how you should reflect in your ePortfolio is to bear in mind that the things that you write in your reflection, and in fact any of your forms in your portfolio, are not subject to legal protection. And this has been clarified by the GMC, so it can be used in court for or against you, however that it was phrased. So be mindful. So I'm not saying don't reflect, but there's a way that you should reflect that makes it safe for you to pen out your thought processes. I think you have to be careful when reflecting on medical error specifically. And if you are reflecting on a medical error, you want to focus on the learning points rather than giving too many excessive details about it. You can always talk rather than write. things out. If you need to let it off your chest, you can always just verbally express it rather than writing it down. If you're the kind of person that prefers writing anyway, you could also write in your personal diary. I'm not saying to never write about medical error, but when you do, just be careful of your choice of words and the things you put in them. And I'm also not saying to not reflect at all, because reflection is very, very essential for doctors' growth. And in fact, I personally am such a big advocate for reflection. I find myself to have grown so much through the art of reflection. And alhamdulillah, for me, I managed to even get a publication out of just my reflection, when I pondered about the absence of a hijab substitute in theatre, and why there should be an option of a disposable hijab in theatre. Right, and another important thing to be aware of in your foundation year, in fact, in your journey as a doctor in training, release your ARCP. Always start with the end in mind. This basically is the final sign off for each year that you progress. So make sure that you know what you need to do and what you need to achieve at the end of the year. And the thing is, you don't actually have the entire year. Your ARCP forms need to be, I think, sorted in the last few months before you finish your year, and it varies from school to school. So find out how your ARCP form is in your actual deanery. Right. So going into the bulk of the talk, which is in career planning, I do believe in this quote mentioned by Benjamin Franklin: "If you fail to plan, and I think you are planning to fail, unfortunately." But is it true? Is it absolute? You always have to plan and you always have to follow what you plan? I think we need to have a little bit more balance when it comes to planning. Yes, you are the captain of your own ship, but I think you have to allow a degree of flexibility as well, because there might be other opportunities that come your way, and is probably better than your original plan. But regardless, I still think you should know what to aim for. So having a plan is essential, but have a balance. And in talking about balance, I really like talking about balance. So you'll realize that every time I make a point about something, I'll always try to provide a counter argument for what I advocate. So as a doctor, you'll realize that you have your time and your energy is divided into two aspects when you work. One is to provide service. That's just basically doing your routine day-to-day jobs, your ward rounds, your jobs after the ward rounds, on calls, etc., discharge summaries, especially as a foundation doctor. And then there's another arm that is important as a doctor is learning and development. These can be, this can comprise of, research, audits, exams, leadership, teaching, etc. Things that helps you to grow as a professional individual. And where is the balance? I'll be a little bit biased here, and I think you should put more emphasis on your learning and development, simply because there are people and there are measures in place to make sure that you provide service. There are consultants, there are Rotor coordinators, there are discharge coordinators, there are nurses that will make sure that you do your job. Now, obviously, the GMC, to make sure that you uphold to the standard that you should deliver. But learning and development is so important, but you are the only stakeholder that is responsible for your own learning and development. If you do not want to learn and develop yourself as a doctor, no one else will force you to it. Maybe your supervisor, but at the end of the day, it's you. It really is a self-directed learning. So I would recommend to put an emphasis on your learning, your training, your development. So as a foundation doctor or foundation doctor to be, I really recommend you to have a think of what you're interested in. What specialty are you looking into? Because the earlier you know, then the earlier you can prepare for what you want to dive into. And I'd advise you to limit your interest to maximum probably 3 areas of specialization. I understand that it can be quite difficult for you to narrow down your interest when you haven't started working yet. So that's fine. But there are things like career day where you can talk to people and find out a bit more about the specialty that you're into. Taster days where you can, follow a specialist doctor around, follow consultant or registrar, anyone who's already in this specialty, to just have a taste basically of what the career is like and whether you would like it and want to do it, for the bulk of your career. You can talk to people, your colleagues, your clinical supervisor, educational supervisor, etc. And I'm sure they can point you out to things that will make you consider whether or not the specialty is something that you want to do. And then once you have narrowed down your interest, then you can find a portfolio scoring criteria. And I'll show you this later. To start building up your CV quite early. And I believe this is especially true this is especially important if you want to go into quite a competitive specialty. Now, talking about competition, I just want to introduce a concept called competition ratio. And as you can see here, and this is the website that I got it from, and it shows that, some specialties are much more competitive than others. So for example, let's have a look at, core surgical training, So you can see that the ratio is almost 3. So which means that for every 3 applicants, only 1 person actually got into the job. And this is you have other specialties which are more competitive and others which are less. So this is I'm telling you this not to scare you if you're into competitive specialties, but I'm just highlighting this so that you are aware that you might need to do more and earlier work if you're aiming for specialties which are more competitive than others. And there you go. So you start applying for your specialty after F2. Actually, it's not really after F2. It is actually in your 2nd year of your F2 that you need to start making applications. So actually, you might not have as much time as you think you would have, especially if you're planning to jump into specialty training right after you finish foundation year. There you go. And so I'm just going to talk about some of the ways you can boost your CV and ultimately increase the chance of you getting into the specialty that you want in the deanery that you want, and especially if you want to jump in straight after foundation training. So one of them is an audit or a quality improvement project. And it's a way of you to, so if you're not familiar with the concept, this diagram's quite useful. And basically an audit is a way for you to find out whether your current practice actually adheres to what the standard is, what the actual standard is, whether something locally set, regionally or nationally set standard. If you can have a look at the chart here, you have to identify what the problem is, find out what standards, collect some data, compare it, and then you implement the change. For example, like education, poster, or any kind of intervention, and then you re-audit. So you basically repeat the entire bit, bit 1 to 4, and so basically that's what re-audit is, and then see if you have made a change. And that's what a re-audit is, and that's what a complete cycle loop is. Okay, so I put the star here for re-audit because that means that you have completed the audit cycle. Because you realize that most people, some, I'm not sure the number actually, some people only do part of the cycle, and that won't score you as much mark if you actually re-audit or close the cycle loop. And so I think I already mentioned some of the points there. So how do you want to maximize your points for audit is to lead the audit, rather than to just be involved in one small part of the audit, for example, like data collection. It's better if you design the audit itself and you carry out, some of the project, write the report, etc., presented. Okay. And secondly, like I said, close the loop. And you get points for leading, even if you only do the first set or the second part of the loop. You want to present your audit. Obviously, the higher the level is, the higher the level of the presentation, then the higher points you get. But if you can't get to present your audit in like an international, national meeting, that's fine. Just make sure that it's presented. And I think I just want to broaden your, the spectrum and broaden your option. You don't have to do an audit in your field of interest, okay? And that's, you still get the same point. The points are transferable, but there will be extra points of commitment. If you do it, say, for example, psychiatry and surgery, and I pick this specific example because I'm into surgery, but my my closed loop audit, as you can see, re-audit here, is actually in psychiatry, and I presented it at a regional meeting. So that actually scores me quite a high point because I led it. As you can see, my name's the first. I've completed the loop, so I've made a re-audit, and I have presented. This is actually the first page of my presentation. Yeah, so I think the point that I want to make is that it's better to play a big role in a small audit, because my audit is pretty small, really. It's quite a simple one as well. And rather than a big role in a big, rather than a small role in a big audit, like for example, you're involved in a national collaborative and the only thing you do is collect a couple of data, that wouldn't score you as much points, if you do something like this. Right. So the next one is on research or publication, okay? And there are different types of research, but what a research essentially is that it questions what is the best practice or how we can improve practice, really. It is with the purpose of contributing to a body of knowledge. So those are the steps of research. You choose your topic, you make a plan, collect data, analyze it, you write, and then you present your findings. I'll be honest, I haven't actually read these books, but my academic registrars highly recommend these too. So if you're into research, then this might be something that you want to invest your money in and dive into. So some tips for research and publication. Well, I will be quite frank. It is a relatively difficult section to score in your portfolio. So if you're not into it, don't beat yourself up, okay? What I think is reasonable is for you to familiarize yourself with the concept of research. You can always start small. You can always, just start with helping to collect data and then, slowly build your skills up. That's fine. I find it very helpful to find a senior colleague who is experienced in research, like for example, an academic registrar. They're always very keen to get people on board to help them, with research, or even just to do, to help you, conduct your own research, And I find that it would be easier for you to do research in a teaching or in a tertiary center, because these big hospitals are generally very keen into, research, training, etc. Another tip that I want to share is that you can always half your work by doing a joint authorship with your colleague. So you both can carry half of the weight of the job burden, but still can claim for the first authorship, if you think that's reasonable. And that's actually what I did, and I'll explain that in my example. And then you can always join a research association, take part in a collaborative work. But I think you need to bear in mind that it can take a long time before your work actually gets published. So we're not talking about a few weeks or months of work. It could possibly take up to a couple of years, if I'm honest. Which is quite different from audit, where you can probably accomplish it within a few months, really reasonably. So this is an example that I got, a research that a systematic review that I've done, and it might not be very clear here, but that's my name and that's my colleague's name, and we are both the first author. So we're both into surgery. So when we applied, we both put our name as a first author because it was a joint authorship, and we actually got strong points for the application because of that. The next section that I'll be talking about is leadership, and this is a part of the portfolio scoring criteria. As you can see that the more involved you are with each section, the higher your points will get. And then they also explain what evidences that are acceptable. Some tips are to apply for a leadership role. So find out anything available that you are interested in, whether it be locally, regionally, or nationally. And there's also training in leadership as well. I think some people might not know and might be interested in leadership. So there's Edward Jenner, which is online and free. There's Mary Sequel. It actually cost up to £1,000, but it can be free. If you apply through your trust. There's the medical director clinical fellowship, but you can only apply for after your F2. But that's something, in case if you're interested in leadership, there are trainings as well as roles available. And I just want to share about the Iceberg model. And I think it's important for me to just talk about this a little bit, because you'd find yourself, on reflection, seeing other people's success, or even seeing your own successes, and then realize that they look very small at the tip, but what really is big at the bottom, and what drives all of your efforts and which led to your achievement is actually the reason why you do the things you do. What traits you have, how have you behaved, your self-image and roles, etc. And I think it's important for us to know why we do the things we do, to keep going, and to endure the difficulties, because things will get hard, and I've been known to achieve some of these awards and prizes and recognition. But I think what people don't know, and I think it's important for me to highlight these as well, is that I didn't do it by myself. I had a mentor, and I value my mentor, my network, the people that I work with. I didn't do it by myself. That I am interested in what I do. Okay, and I think the reason why I need to point that out is that you realize that there are so many avenues, so many platforms for you to make a change, for you to excel, for you to push yourself in, and everybody will have like a different aspect that they're attracted to. So for example, I'm quite into innovation, and I'm quite into leadership, management, changing status quo, and so I sort of invested my time and energy into that. But if you're into teaching, and if you're into research, etc., go for it. There's always avenues for you to dive into. So it's important for you to have fun and have faith. And I think I need to sort of just share that with with some of you, who's probably trying to find a way to maybe push themselves to improve, to basically improve in whatever aspects of their career. And so I think I'm reaching towards the end of the career development talk. There are other areas that I have not touched in this talk, such as training and teaching experience, presentation, awards, prizes, specialty exams, degrees, qualification, and commitment to specialty. But we actually have hosted a CV workshop. Okay, if you go to the our YouTube page, you'll find it there. There's another webinar coming up, which is the interview skills. That's happening in the next couple of months. And if you're into specific specialties, like for example, GP or psychiatry or medicine, surgery, we have recorded dedicated webinars for each of those specialty applications. So feel free to dive into our YouTube page. And of course, I've spoken so much about checklists and ticking the box, and about the things that you have to do to get this point and that point and this section and that section. But don't forget your own personal section too. What's your to-do list and what matters to you? I feel like I'm obliged to share this as well. I think as a Muslim, I realized that when I was doing my portfolio, when I was going through my checklist, my portfolio checklist to apply into surgery, I asked myself, actually the biggest application that I'm going to make is actually to enter the heaven, to enter Jannah. And I'm not sure if I've done enough. And I think I need to spend a bit more time on that particular checklist as well. So I think we need to do that kind of reflections for our own spiritual and mental health too. Some other bits and bobs are about leaves. I mentioned about tasty days, so you can have up to 5. But double check, it might change from time to time, especially with COVID. Study leaves, there's also aspirational leaves that are allocated for FQs. It's £300, so you want to make the most out of it. And then there's the Rotor guide. If you find yourself, overworking, you might just check if it's compliant to the junior doctor Rotor guide. That's just a glance of the Rotor rules. If you're into finance, you might find this website useful. some things that I've worked, and I think you might find useful as well if you, if you cover your head for faith purposes, and you might want to know what options you have when going to theater, and if covering your forearm is something that's important for you. We also have developed a guidance on forearm covering in the NHS. If you find yourself to be a victim of bullying and harassment, or even want to advise someone who's going through some of these issues, then these are the resources that you might find to be helpful. So we've come to the end of my presentation. So I think in 3 simple points that I want to make is, 1, to stay on top of your e-portfolio. It's quite straightforward, quite easy to do, but it's so important. So you want to, want to get it out of the way, and you want to start early. Secondly, I think you need to take accountability of your own learning and development, because no one else would do it. No one else would pressure you to learn and grow if it's not you. So take accountability, take ownership of that responsibility. I think, and lastly is to, strive for excellence, and, don't just survive for existence. Obviously, some days are harder than others. Some days are more challenging than others, and that's okay. That's fine. And you can just, take a, you can just unwind yourself. You look after your, mental health, spend time with your family, etc. But I think ultimately you need to know what you want to get out, of your career, and what you want to get, aim for what you want to get, and how to get there. So try your best, to have ihsan, which is, excellence in things we do. And I wish you all the best. Thank you. Those are my ways to reach me. Assalamu alaikum.